ISBNPA is the International Society for Behavioral Nutrition and Physical Activity. Having the ISBNPA meeting in Austin is really a great honor for us. We're able to show the Michael and Susan Dell Center as an epicenter for this type of research. It's an opportunity to have our international colleagues see the type of work that goes on here, the context in which we work, and it gives us the opportunity to network with a variety of people from around the world who have the same aims as we do. Well, one of the things we know is it's hard to make changes in one country without it affecting other countries. And so when we do research, we understand how much we are connected in various ways. And so it behooves us to work together and look for these solutions to increase healthy eating and physical activity together. As an example, just listening to Dr. Rivera's talk, we see several of the same situations happening here in Texas. And so it's nice to see how they've solved the issue and how we can apply that to problems here in the United States.
A challenge that we have is that food industry has become a barrier for development and implementation of required changes in regulation. And this is really a very difficult issue. Process and impact evaluations are crucial for ensuring systematic learning from actions and strategies implemented in different settings and different countries.
I've heard several references to Dr. Perry's keynote talk at the beginning throughout the conference. People have mentioned it in the sessions.
So while increasing food prices, even for unhealthy foods, is probably not a popular solution, some foods might warrant increased prices via excise taxes. Such foods such as sodas, fast foods, and high-fat convenience foods, a Twinkie tax.
We had Dr. Pedro Halal, and he gave us a call to action for actually collaborating with some of our colleagues in South America.
Individual behavior is different from population behavior. We learned that several years ago with Jeffrey Rose's graphs on sick individuals and sick populations. If we really want to improve diets and physical activity practice worldwide, we need to look at with public health lens and not with individual behavioral science lens.
We were really fortunate to have Dr. Robert Kaplan here yesterday morning to talk about the direction that the National Institutes of Health is taking in regards to behavioral science research. So several of the issues that he presented are things that are strategies we are working on at the center. For example, he's talking about how do we incorporate data capture in many of the mobile devices that are out nowadays.
We do think the world's changing, and we think that the nature of research will change as well. That representative designs, where we bring the laboratory to people with electronic devices, is going to be a new frontier. But we're at the infancy stage in studies now. We know that a lot of the claims that are made by these device manufacturers don't stand up to rigorous evaluation. We think that we need a new basic science to evaluate this type of behavior change. And we think that there's going to be a great opportunity for this. We have to learn about new data. We think that the analysis techniques haven't even been invented yet that will help us understand this data. And we think there's going to be great opportunities for cooperation with private industry, with governments, and so forth.
I have a lot of friends here at ISBNPA from all over the world, and it's just wonderful to be able to visit with them, see what they're doing, see what the current pulse is in regards to nutrition and physical activity research around the world. One of the things I think that's really nice about this conference is it's a small enough size that you can get to talk to anybody. And so a lot of these people are giants in the field, and a lot of meetings you don't get that personal interaction with. And I think the setting is conducive to that. So there's a lot of little areas where people can go and groups spontaneously form and get to know each other. And I think that that's part of the academic process. And so I think that ISBNPA typifies that.